Dr. Osterberg, let's talk again, because something which is almost, it looks like an oxymoron to many people, and that is evidence-based chiropractic. I mean, for all purpose, chiropractic for a few years, or for the last, 100 years since it's around, it has somehow gotten this, like, a quack. It's like there's no science behind it. At least for a while, the MDs were pushing that line. They definitely backed off of that. There's no doubt about it. Tell me, I know you're a very big evidence-based guy. You're not just pushing vitamins because it's hip or because it makes sense. You really are researching and making sure that there is evidence. How you go about it, and what does that do to your patient?
That's a great question. That's a topic that is near and dear to my heart. I believe that no matter what specialty you're in healthcare, the evidence-based approach is the best way to go. And what that means is that you're not just making decisions by the seat of your pants. You're not just thinking, hey, I tried this one treatment one time and it helps somebody with a similar problem, so I'm going to try it again. You're looking at, what does the research say? What does it prove is the safest treatment? What does it prove is the most cost-effective treatment? What does it prove is going to get us the fastest results? And what has been proven to give us the longest-lasting results? And that's what we all want from our doctors.
Longest lasting. I mean, obviously we live in a speed of age. I mean, in an age of speed. We want instant result. But when you really dig deep into most people, and you ask them, they would be willing to sacrifice a few days or weeks or even months on something if afterwards they know there's a lasting. So I think in the end, lasting is very important.
Yes, absolutely. Typically most of our cases are back problems, neck problems, and headaches, or combination of back pain and leg pain, or neck pain and arm pain. That's 90% of the problems that we take, the patients that we accept in our offices, are for back problems, either injuries or problems that have been coming on very slowly and very gradually over time. But since we're focusing on those things, we want to get relief from the pain very, very quickly, but then we want to help that patient develop a program to help them prevent the problem from coming back. Back injuries have an 85% recurrence rate within 1 year. If you hurt your back today, there's an 85% chance you're going to have another episode within 1 year. And if you do, there's another 80% chance you're still going to be experiencing repeat episodes 5 years down the road. So you're going to be seeing a chiropractor or a physical therapist or your family doctor for pain medicine or going in for injections over and over and over. And the way we can stop that downward spiral, that process, is to catch people on the first episode and change the things that put them at high risk for back pain. Now, in my particular practice in chiropractic, the evidence shows us that what the chiropractor does, hands-on treatment, is really good at reducing back pain. We can get phenomenal results. A new injury, we have 89% success rates within a month. We have very, very high success rates with new injuries. With chronic conditions, it's not quite as high. It's in the 70%, but we still get very good results for chronic back pain conditions. But once we achieve pain relief and the patient's function is improving, prevention is all about exercise. It's looking at flexibility, looking at strength, looking at posture, looking at muscle endurance, looking at coordination, looking at their overall conditioning. And if they have weak spots in those areas, then they're just doomed to re-injure their back or future neck problems. So we address all of those things with our patients as soon as possible, as soon as their pain has been relieved, and then get them on an exercise program and working on those things at home. And by doing that, we've been able to get very good results, and we're able to do it with as few visits as possible in our office.
Great. Now, 2 questions here. Number one, maybe even 3. Number one, have you ever seen that? You mentioned that people go to 5 years they might have a problem. It's just a number out there. And so if they go to a pain doctor and get pain medicines, injections, whatever, does the actual cause of the pain ever go away? And wouldn't the person then have to go 10, 15, basically forever, so that the pain gets masked, but the thing really doesn't go away, or not really?
Everybody's different. Every patient's different, and it's really tough to judge what is the cause of a particular patient's problem when you first meet them. It can take some time to figure some of these things out. But in general, if somebody's been having recurrent back pain for 5 years, their future does not look as bright as somebody who just hurt themselves for the very first time. Really, the goal of all of us in healthcare, whether you're seeing your family doctor with a back injury or whether you're coming to a chiropractor or they send you for physical therapy, the goal should be, how can we make this patient feel better now, and how can we prevent them from becoming a chronic back pain patient? Because once somebody reaches that point of the pain never really goes away, I never really have good days, I just have bad days and worse days, it opens up a whole other can of worms. Those patients start missing work. That creates financial problems. That creates stress. That leads to depression. It's just this descending cycle of deconditioning. Every time I do something, I hurt, so I do less, and now my muscles are becoming weaker, and now my back problem's becoming even worse, and now I can do even less, and they just get into this cycle of deconditioning. And so our goal really is to try to break that cycle the very first time that somebody hurts their back. And it's not hard to do if you can get them to consistently do some exercises a couple of times a week. For the vast majority of patients with back injuries, it works out very, very well.
And I assume those exercises should be specific exercises, not necessarily the same for every person, since it's not the same muscle. And we do. It's not just for me to say, okay, I exercise, I go and do a few push-ups and a few sit-ups, and I'm done. Not that that's a bad thing, maybe, but it might not help me with my back pain. It has to be guided from a guy like you. Say, do this, and do that, and do it 2-3 times a week or whatever it might be.
Yes, we don't use a generic prescription. Because you hurt your back, you have to go do these 5 back exercises. I wish it was that easy. We run each of our patients through a guided series of 25 tests where we're looking at their physical performance. How is your strength in this muscle group? How is your flexibility in this muscle group? How is your posture? How is your balance? How is your coordination? And we're looking for which areas are okay out of those 25 and which areas are not okay. And when we find the problem areas, our exercise goal is to specifically improve their performance on those specific tests. I can have a husband and wife who say, they joke and say that, the back pain must be contagious because he hurt his back and now mine hurts. Well, they may go home and do totally separate exercise programs based on what we find on their tests. And you get much better results when it's individually created like that.
So basically you keep in mind the purpose of what you want to fix, and so exercise does not equal exercise. I mean, one exercise is going to make us strong and make us play better tennis and whatever it may be, or may just get the heart better pumping, which is all good, but not necessarily. So you have a great heart pumping, you're fine, but you're still having back pain, for which you need a different type of exercise.
That's correct.
Thank you very much, Dr. Osterberg. Thank you very much.
Thank you.